Welcome to this talk, and I'm delighted to welcome back Adam Rowland. Adam, thank you for coming back.
Oh, hi, John. Again, it's my pleasure, not just on behalf of myself, but on behalf of all the people like myself who are struggling. It's a real privilege to be on here, and we're really grateful that you give us a platform like this, and you're prepared to listen to us because, it's been a long fight for the last 3 years to try and get anybody to listen to us.
Yeah. I think this is one of the fundamental problems, Adam, that people are just not listening to what individuals like yourself are saying. You know, if someone says they've got a pain, then they've got a pain. Pain is defined by the reporting person, and we simply have to believe our patients. And this is the big thing that is not being done anything like as much as it should be. But just give us a lot of people are following your progress or lack of progress or whatever we'll call it, Adam, and it's noble of you to share it. And but for those that haven't met you before, just give us a brief introduction about the history of what happened.
Yeah, so obviously I was very fit and well before that. For anybody who didn't know me, I had a great career, fantastic job. I worked in professional sport for many years. I used to exercise twice a day, so quite a vigorous cardiovascular workout in the mornings. I'd go about my job and lift weights in the afternoon. And then I got the AstraZeneca vaccine, the first one, and I started to immediately experience side effects, but I didn't attribute the side effects to the vaccine because I'd never had any.
Why should you? The vaccine's safe and effective. Why should you?
Yeah, I had the immediate fevers and everything else what people got, and I thought that's it. And then I started with all these other crazy symptoms, which, I picked up the phone to the GP. GP just went, "Oh, it sounds like stress, panic attacks, anxiety kind of stuff," and it went down that road for about a month until it was clear that wasn't the case.
What were you experiencing initially, Adam? What was the first things you felt?
Yeah, the first things I felt were, it was really bizarre. I get like a neurological pain all down my left arm and my left leg, and like restless legs, like neurological stuff in my legs. And my wife at the time was noticing I was flailing my arms and legs about trying to go to sleep, and she'd be like, "What's up?" And I'd be doing it in my sleep, and I'd be like, "I've got these horrendous pains. I don't know what it is." And then the next thing after that started fairly immediately was, I now know they're like palpitations and ectopic heartbeats, things going on with my heart. So I'd wake up in the middle of the night and I felt like I was dying. It was really bizarre, and it felt like my heart was stopping.
Horrible though, terrifying.
It was terrifying, yeah. And then it turned into insomnia where I couldn't sleep for like 3 and 5 nights. And so I got on the phone to the GP, and he said it was like, "Oh, it sounds like nocturnal panic attacks." So I was like, right, okay.
Sake, was this guy trying to be a psychiatrist or something? But the point is, even a psychiatrist wouldn't do that, because a psychiatrist is a doctor of psychiatric medicine.
Right.
And he knows that above all, you must eliminate medical, biological causes of disease before you start calling someone a head case.
Right. So,
Appalling.
I didn't know any different because I never had any side effects to anything, and I went along with it. And then the disastrous mistake was, I had the second vaccine a couple of months later, and it became very obvious then, because my heart immediately, it let me know in uncertain terms, ended up in hospital. And, from there, I've just got sicker and sicker, very, very gradually, but sicker and sicker, yeah.
What caused you to go into hospital that first time, Adam?
Yeah, so obviously I started to complain about my heart between the first and second vaccine, and I was on a waiting list for a ECG. But there was a huge waiting list. So what I did was, because of my position at the professional club I was working at, we actually had a club cardiologist. So I just got desperate.
You're a professional physiotherapist.
Yeah.
Professional.
So I phoned up the club cardiologist and I said, "Look, I'm getting all these symptoms. My doc said it's anxiety." And he said, "Well, maybe, probably might be." He said, "But we'll do an ECG." And then basically he picked up on the ECG, because it was a 24-hour one. You press the thing when you're having an episode. And it turns out my heart was going into VT, ventricular tachycardia, when I was having an episode. And
you sent me those tracings.
Yeah,
I recognised ventricular tachycardia on those tracings because I used to work in coronary care, and I have checked with a cardiologist, and it is in fact ventricular tachycardia. There's no question about that.
Yeah, I mean, I do know that because I paid privately to see a cardiologist. And to be fair to them, I had a couple of like fainting episodes, and the second time that happened, after speaking to having had ECG proof of this, I was told if it happened again to go straight to hospital. I went straight to hospital. I showed them the copy of the ECG, and to be fair to him, they put me on the acute coronary care unit, like a high intensity unit, and they did take it quite serious from there.
They're completely correct to do that. Yeah.
Yeah, but then that's where the story and my long journey started, if you like, John, because they were completely bamboozled essentially as to the cause of why my heart was doing this, and whether I was indeed safe at the time. So that was where the journey started really, and they looked for, I said this has all started immediately. I said it happened after my first vaccine, but I've got chest pain now with it after the second, and told them my symptoms were getting worse. So they were looking for blood clots because my D dimer was raised. They didn't find blood clots, and because my resting heart rate at the time was in the 30s because I was very fit. So they were suspecting something called Brugada syndrome. Initially, they said, "Oh,
Which have a low heart rate."
Yeah. They said it's unlikely to be the vaccine after they couldn't find clots. So yeah, that's when my journey started, and then essentially I started to develop more symptoms. Like a month or so later, my vision was blurred, face rashes, tinnitus, the pains. I developed all these like neurological pains in my legs where instead of them going completely down the legs and being intermittent, it was like somebody had amputated me below the knees. And it was the same as what Brianne described on her interview with you the other day.
Yeah, Brianne Dressing, of course, we interviewed just a few days ago, and
Yeah.
you noticed similarities between your presentation and hers.
Yeah, so the pain that she describes in her legs and arms, I would say is exactly the same. So I feel like, so I'm in constant neurological pain in my arms and my legs particularly, but at very best it's like a 4 out of 10. But I get flares every single day where it goes to 7, 8, 9. I want to chop my legs off. I never know how long it's going to last for, John. So sometimes it'll start at 6 p.m, keep me up all night till 7, 8 in the morning. And I literally, exactly like Brianne said, I'll be honest with you, I've had lots of moments where, I've considered, I'm like, I feel like taking my own life at times because it's so painful. Because
you just want it to go away. You just want relief from that horrible pain.
Yeah.
Brianne described it as like rolling in cactus all the time. I mean, it's just unimaginable, Adam.
It's really hard to say other than when it's severe. I can't keep my legs still because it's impossible to sleep and ignore. So the only way I cope with it, John, is I try and move. So I put some other neurological stimulus into my brain to try and override that, but it's pretty impossible because I try and walk through it and it makes it worse. And I would describe it as it's like being plugged into, I imagine, the mains, the electricity mains, and it's going down all the backs of my legs, and it's like also someone's dragging a knife down the backs of my legs constantly. And I literally, I grab my legs and I just want it to stop. And at times I feel like, should I just chop my legs off? That'd be less painful. And I feel
it's like you're being tortured with electricity in a torture chamber somewhere.
Yeah. So I feel really guilty for saying that statement that I've just said because I am functional. I can move my arms and legs, but
you're not paralyzed. This is the sensation that's the problem.
Yeah, but there's times where I do consider a quite frequent basis where, I'd consider having them chopped off because it's so bad.
Of course, the irony is that although the pathology is probably in your legs, there's probably peripheral vascular disease in your legs. Neurological pain, as you know, can be phantom.
Yeah, I mean, my case is very complex, which is one of the reasons, I'd like to talk to you today to explain that to people. And one of the things they've said to me is they've called it like they think I've got like quite a severe, they've called it thrombolytic vasculitis, and
Yeah.
they're saying the pain is ischemic pain, and they call
Ischemic,
it,
not enough blood supply. Yeah.
yeah, they're calling it a vascular neuropathy is what they think.
I think that's there, but a lot of these pains you're describing, Adam, are clearly neurological pains.
Yeah,
Clearly. The ischemic pain is crampy. We have a condition, it's called intermittent claudication. The ischemic pain is well described and well known, but while you have that, you clearly have neurological pain as well,
yeah,
probably caused by inflammation of the peripheral nerves. You've got both. So you've described neurological features, you've described cardiac features, the chest pain, and the rash. You're also describing immunological features. It seems to me you're getting a whole spectrum.
well, yeah. I mean, one of the things, John, that, to be fair, I don't want to come on here and criticize doctors individually, or because this is, we're in new territory here. But one of the things all the way through is nobody ever, because I've had such a multi-system complex presentation where, I'll go on to tell you it's in my heart, my lungs, etc., everywhere.
Yeah.
My complement system, so my complements blood tests initially when I first got injured in hospital were very high.
So this is part of the natural defense against disease, the complement cascade.
Yeah.
That's designed to get rid of bacterial infections.
But what's happened since then is, which I didn't even know, it's just, it comes to my attention, but my C4 complements is now chronically low and has been that way since the acute nature of whatever happened to me. And I didn't even know, John, because the first I heard was I got an email and a letter through the post from the NHS England. And I got a letter through whoever's the chief medical officer. It's a standard letter, and it said you're immune deficient, and if you catch COVID or any thingy, to present to hospital with this email and show them straight away. So I didn't realise that I was actually immune deficient. So I've looked into my medical records, and all I can find is they did an immune deficiency panel on me way back a year or so ago, and my B cells, particularly CD19, was extremely low. So I don't know what bearing that has, because again, my presentation has been a lot of abnormal findings, but none of them, from what I can gather, fit a known disease process. That's
This CD19, it's a subdivision of the lymphocytes,
right,
which are normally used to fight viral infection.
right.
They've become low for some reason. It's a very strange immunological presentation.
Right, yeah. So where I'm up to...
Are you catching more infections, Adam? Are you getting coughs and colds and things all the time, or?
Yeah, so one of the things that I don't go out very often because, it tends to be for a hospital appointment, or maybe if I'm lucky on a good day, meet a friend for a coffee.
Yeah.
I do tend to pick up just colds and chest stuff all the time, yeah.
Can you describe this chest pain you were getting? Because part of the reason we do these videos is other people recognise the symptoms. So
Yeah.
what was the chest pain like that you were getting?
Yeah, so as I speak to you now on my best days, do you mean my chest pain at the beginning or now? Sorry.
Yeah, more at the beginning. Both.
Yeah.
At the beginning when it was acute.
Yeah, so the chest pain, no chest pain, and it just felt like my heart was something in my chest was being crushed with very high intermittent stabbing pain. So what I told myself, John, was, because I was still trying to actually, it was a bit silly, but I was still trying to actually lift some very light weights to try and maintain what I had. So
you were trying to cling to normality, weren't you? I mean,
that's all I knew. Yeah. So I told myself, it's just costochondritis, which I knew it wasn't.
Yeah, which you know about as a physiotherapist.
Yeah. So I was just trying to minimise it in my head. Yeah.
Which, of course, is perfectly normal. You try and minimise it. You try denial because you don't want to have a cardiac condition. I mean, it's completely understandable. What about your renal function, Adam? I think that's gone down a bit, has it? Your kidney function.
Yeah. So it's just on my estimated EGFR, so it's just
estimated glomerular filtration.
Yeah, so it's just slowly crept down from where it was. I think it was around about 100 to begin with, prior to being injured. So, and then I think it's into the 60s and stuff like that, and a bit lower now. So I don't know too much about it. As in, I don't get any pain, but I got a letter from a cardiologist who'd spotted that on my bloods, my kidney function was decreasing. So he suggested I go and see yet another specialist about that, a kidney specialist.
You've been passed from pillar to post a bit, haven't you, as would say in English?
I could tell you how many different specialties. I can list them if you wish. People would find it unbelievable.
Give us an illustration, Adam.
Okay, so let me count how many cardiologists I've seen. I would probably say one, two. I've seen about 5 or 6 cardiologists. I've seen three neurologists, 2 of them specialists in muscle disease. I've seen 2 respiratory consultants. I've seen 3 different endocrinologists. I've seen, let me think who else I've been sent to. I've seen a vascular surgeon. I've seen 3 different hematologists.
And is there anyone actually in charge of your care?
No, so that's the trouble where we stand at today, John. So essentially, just to give everybody a brief update from last time, because I know it's confusing. After I spoke to you last time, I actually had an invasive heart catheter. So they basically diagnosed with my heart that I've got microvascular disease in my heart, which fits with everything else that they found. But they also said to me, the cardiologist, who was really good to be fair to him, he said to me that I suspect, looking at your biopsy results and everything, all your other anomalies from your test, that you've got an autoimmune condition with your heart. And he said exactly what you're describing to me presents very much like a inflammatory myocarditis kind of thing. And because of what's happening with COVID and the vaccine, he suspects that that's going on like almost like a subclinical level. So he said to me that he feels that high dose steroids for me temporarily are the way forward. And the plan that has been discussed, an MDT took place between the respiratory consultant, the neurologist, and a few others, and they felt like steroids and immune suppression is probably the only way forward for me on the NHS, what they can provide. So the cardiologist felt that was the right way, and feels like what's going on with my heart is, with all my symptomatology, he feels it's like a myocarditis pattern, an inflammatory pattern in my heart. So, because he said the microvascular disease does not fit my presentation clinically. So he's left it to everybody else. Now, the trouble that we've got from the MDT is, unfortunately, the MDT I was under a long COVID clinic on the NHS.
This is a multidisciplinary team.
Yeah, and it was run by a very, very excellent doctor there who was trying their utmost to help me. But unfortunately, it was decided between the MDT that let's try him on steroids and immune drugs because we don't know what else to do for me.
So this is basically shotgun anti-inflammatory treatment, isn't it?
Yeah.
Steroids would just prevent all the inflammation in the body.
I've had two courses of steroids before. I was bedbound with pericarditis last year and was on high dose steroids. So that the heart stuff keeps coming back, and I've had 2 lots of steroids for it before. So yeah, essentially it was decided that the long COVID clinic should oversee my care. Now, I actually received a letter from the long COVID clinic around about 6 weeks ago now, and the long COVID clinic at the hospital have actually said you shouldn't have actually been seen in the long COVID clinic. You're vaccine injured, so you're not to be seen in the long COVID clinic.
So the long COVID clinic said you are not suitable for them.
Yeah.
Because you haven't got COVID injury, you've got vaccine injury.
Yes.
I find that bizarre. I find that utterly bizarre. Never mind. Yeah, go on.
And then in fairness, the consultant who ran that clinic has said also they feel that because of the complexities of all my diagnoses, which again I can talk about them again if we need to with the biopsies, they felt that they wasn't the best placed person to supervise essentially what they're classing as experimental immunotherapy. So they decided that they were going to refer me to the vasculitis service at the tertiary centre. But what has happened to me before, John. So they've referred me, and I've received a letter to say the vasculitis service think I'm too complex and they can't help me, and they don't want to take responsibility for me, so they've passed me back. Now, this happened a year ago, John. I was under a vascular surgeon who turned around to me and went, I don't need to stent you anywhere. He said, but I think it's like you've smoked 60 cigarettes a day all your life. I think you've got small blood vessel disease everywhere. He said, I'm going to refer you to rheumatology, which refused to see me a year ago. So essentially, my kidneys have got worse, my heart's got worse in this last year, and I've still got no treatment. And that's where I find myself today. Nobody knows what to do with me, essentially, which is a problem because, you know, it says in their letters that, you know, I've got myopathy, which they're saying is untreatable, the kind of myopathy I've got, you know, and they're finding all these abnormal tests with me, but it doesn't fit a known disease process. So they're saying...
You should have read the medical textbooks before you went to the doctor, Adam, shouldn't you?
I should have done, yeah.
A nice, neat box. It's just unbelievable.
So, yeah, that's
you would think this would be stimulating their interest apart from anything else.
Yeah, well, this is my annoyance, John. So I
You're
actually
a hot potato.
I actually said at my last consultation to the consultant neurologist. So he said to me, what we found in your biopsies is exactly the same as what we found in autopsy in the organs of people of the deceased that died of COVID.
This is the neurologist.
Yes, the neurologist told me that.
So your biopsy was from where, Adam?
The biopsy was actually from my gastrocnemius in my calf.
Oh, right, from your calf muscle, right. And that let them look at the muscle and the small nerves?
The muscle and the capillaries, yeah.
Yeah. And what did the consultant say about this?
So it showed three things. It showed the appearance of myotonic dystrophy, which is a genetic disease, which I'm being tested for with bloods and waiting the results. Because they did actually admit to me it's highly unlikely, but they've said that it's been heard of before, whether vaccines and drugs have mutated somebody's genes. It's possible. So they said that it had the impression of myotonic dystrophy. Then they said it also showed the impression of somebody with myopathy, a kind of muscle disease. And then they also said it showed the complements C5b to C9 all over my muscles, essentially.
In other words, your immune system's beating up on your muscles.
Yeah, and my capillaries, yeah. So
probably destroying your muscle cells if it's complement.
Yeah, because what's happening is they've seen on the scans and stuff that my muscle is being replaced by fibrous tissue now.
Right, so you're losing muscle mass and it's becoming scarred.
Yeah. So this biopsy was done a whole year ago, and nobody from that time knows what to do because it showed up, you know, all those things, and they don't understand it.
It's three things that really shouldn't go together.
Yeah.
So this is the same as the seeing in post-mortem specimens.
I believe that was the neurologist's opinion, just his opinion. Yeah, he's actually documented that, to be fair to him.
So people that died of what?
COVID.
Right, and they're seeing these same features in you.
Yeah.
Now, the big question in my mind, Adam, is: are you still producing spike protein? Now, you do take Ivermectin, don't you?
I do, because it is one of the only things that has given me any small relief and benefit all the way through.
And does your doctor prescribe that for you?
The NHS doctors won't prescribe it, but private doctors will. Yeah. The pain relieving medication, John, I take, the NHS won't prescribe, but, you know, I have to pay for it privately as well.
Yeah. I mean, just tell us about when you first tried ivermectin, and the stage you're at, and the effect, what you perceive to be the effect of the ivermectin.
Yeah, so I didn't actually hear about ivermectin or have access to a private doctor because I was trusting everything the NHS were telling me for the first year. So it was June 2022. I think it was just after I came out of hospital originally. After the blood clots a year later, and it was suggested that ivermectin is working well for COVID, but also for people that are vaccine injured.
By a private doctor.
A private doctor, yeah, because I was suffering with pericarditis at the time. So he suggested that it was worth giving a trial, and he said that there's generally people that respond very well to it, and he suggested that I try it. So I was, pretty desperate at that time to get some relief, and my health was pretty bad. So
This is June 2022.
yeah. So I tried it then, and to be fair, it's the only thing that with my heart, what happens is I'm in constant pain of, again, 3 to 4 at best. And then when I try and do activity, on a good day, it doesn't increase my pain too much, but it's afterwards. So in the evening time, 3 hours later, I get this horrendous pain, and it can last for the night, or if I really inflame it, for a number of days. So I found that the ivermectin really seems to help dampen the pain and the inflammation down in my chest.
Yeah. And what dose? Do you take ivermectin every day at the moment, or just when you need it?
Yeah, I'm just taking it. Originally, I took it every day, but again, because we're in unknown territory here, I now take it 2 to 3 times a week, because I believe that some people have a theory that if you take it every day, the body gets accommodated to it and you get less results. Now, ivermectin has a very long half-life as well. So once you've been taking it every day, it'll build up in the body, potentially be stored in the fat cells, etc., in the body. So I tried to wean myself down to twice a week to see if it controlled my symptoms, and it wasn't enough. So I'm just simply, John, because of the cost, it might not sound too much to a normal person, but I appreciate I'm on benefits. It cost me £2 for a dose of it. So I try and take it sort of 3 to 4 times a week, just to save money, really, more than anything
About a
else.
12 milligram capsule.
I take higher. I was originally on 32. I take about 16.
16 milligrams.
Yeah.
And how much does that cost per dose?
It cost me £2 per dose, so it doesn't matter on the actual milligrams because I get it compounded by a pharmacy. So I just pay £2 per capsule.
Yeah, it's a pity you got to pay that much for it. It's a very cheap drug.
Yeah.
And if you stop taking the ivermectin, what happens?
If I stop taking it, my heart pain goes horrendous. It goes to the point where it starts at a 6 and a 7. It means that I'm not able to engage with people like yourself because I'm sort of starting to get a bit bent over.
Too much pain, yeah.
I can't participate at all with things. So yeah, that's how it affects me. And my life is even more miserable than what it is at the moment.
So things are bad now, but if you stop your ivermectin, it gets way, way worse.
Yeah. And then what happens is once the pain starts to get really bad, once it's been there for a few days of many hours of severe pain, that's when the arrhythmia kicks in and everything else. I start to get other symptoms with it. At the moment, thank goodness, the actual arrhythmia in my heart is nowhere near as frequent as it was before. It might only happen 2 or 3 times in a night, and then it might not happen for a week or so,
That is bad enough, though. And
Yeah.
and when you first took the ivermectin, did you notice the benefit straight away?
I did really, yeah. To be fair, yeah, I did.
Yeah. Right, so things are bad, but you believe they'd be way worse without the ivermectin. So
Yeah,
basically you can't get off it.
No, because I was put on colchicine from the cardiologist, and that's sort of the standard treatment for pericarditis, and it doesn't seem to do anything for me for whatever reason. Yeah.
And for the pain, do the standard things that we give for pain, like amitriptyline for neurological pain or gabapentin or pregabalin, do they help at all?
No, so obviously gabapentin and pregabalin was what they initially offered me, and doesn't even touch it whatsoever. It actually makes me feel worse because I feel like drunk, and I feel like I'm sort of drugged. Is basically the thing. And then they've tried me on tramadol, high dose of morphine with slow release oromorph, and fast relief top up with a fast acting morphine. I've literally had the lot. Um,
And no real benefit from morphine either.
no, the morphine, what it'll do, John, is it'll take the edge off. So if I'm in like an 8 or a 9 pain, it'll take the edge off to like maybe a 6 or a 7. But then it only lasts for about half an hour or an hour, and then
Yeah, and
it's
then you're
like,
zonked with it.
yeah. And for me, I don't want to. I'm 3 years into this, so is that the way that I'm supposed to live my life? I don't, correct me if I'm wrong, John. I'm a physiotherapist, and the way that I was taught was that your nerve endings actually become more sensitive to pain over time if you keep taking
Yeah.
pain medication for a long time, and then you either have to increase your dose or change your drug.
Yeah. And
So that,
after a certain amount of time, opiates actually cause more pain than less pain.
yeah, so that is a big worry of mine, because I don't think I could mentally handle being in more pain.
Yeah. So what's the immediate way forward? Do we know? Have we got? Is there anything?
Um, well, one question you touched on it, and correct me if I'm wrong, and I've been asking this question and not getting an answer from any of these doctors. I feel like I don't want to get focused on this spike protein, but I ask the question to people when, my body's attacking something. I'm like, what is my body attacking? Is it the spike protein? And I say, is my body still producing spike protein from the vaccine? Now, I might be being stupid, but I'd like that fundamental question crossed off the list. And then if that's not a problem, then so be it. But I feel after 3 years that when I bring that up to people, like to the consultants, they just go quiet and won't answer me. So it's clear to me either they don't know or they don't want to tell me.
You know, we know that your antibody to spike protein, because you've shown us your blood results, you've got high levels of antibody to spike protein. So the obvious tests, two obvious tests that need done, is the doctors need to test for your immunoglobulin type M to spike protein, and I believe that is still high. So that's the immediate antibody that's produced straight away. And of course, the other test that we absolutely are crying out for, and I believe this is available in some European laboratories, is a direct test to test for the presence of the spike protein itself, what we call an antigen test. Have you ever had an antigen test to test if you are still producing spike protein?
No, I haven't, and it's something now that I'm going to do, because I don't understand, John, why the NHS aren't doing this. Because look, I'm not trying to point blame at anybody here. I just, like, to me it's like we're waiting. You've got all these problems, these disease processes in my body.
Yeah.
They don't know how to treat them, but like, what's driving it? So let's ask the question. So if it is spike protein, for example, this isn't potentially just happening to me. So it's like, should we not be trying to stop that and learn more about it?
It's the fundamental question. Are these symptoms caused by ongoing production of spike protein? Yes, okay, let's think of what we can do about that. No, okay, let's carry on and think of something else. But get that question out of the way. It just
Yeah,
seems absurd. We have the technology to test for the presence of the spike protein.
yeah,
Why is that not being done? If the Secretary of Health wants to let us know, then she can give
yeah.
us a call.
I,
Why is it not being done?
And I'm coming on here because I'm just a physical therapist, so I'm probably an idiot, right? I've not got that medical
Not
training.
by any means, Adam, but yeah, go on.
So please, if anyone's listening and can either shed some light on that, please do, because I don't get it after 3 years. That can we just answer the basic yes no
The
questions
basic
so we can work down?
questions. Yeah, yeah. Now, if you like, I'm going to think out loud a little bit, and you can ignore this if you want, but I strongly suspect the answer to the question is yes, you are still producing spike protein. And the reason I suspect that is the case is that the ivermectin is largely working by, if that's the spike protein there that's doing damage, then the ivermectin is basically a cover of that.
Right.
It forms a cap on the spike protein and stops the spike protein from doing its spiky damage. And you have to keep on taking the ivermectin, because if you're still producing spike protein, new spikes are coming out all the time. And if the ivermectin is there to cover the end of those spike proteins, then you're going to get less spike protein. And you know that taking repeat doses of ivermectin is associated with lowering your symptoms. So that is completely consistent. The fact that the ivermectin works for you, to me, means that you are still producing spike protein. Now, how long the ivermectin is bound for, how long the ivermectin binds the spike protein for, I don't know. Could be quite some time. But if you were still making spike protein, then there's new spike protein. And that's waiting to be bound by ivermectin, otherwise it causes severe symptoms.
I believe.
I mean, I don't know, but that was my...
I believe, see, one of the treatments and therapies that I've been turned down for over here is something called intravenous immunoglobulins, IVIG, which is very expensive.
Yeah, Brianne had that, didn't she?
Yeah, my doctors have asked for that, but because I haven't got a licensed condition and this is new, what's going on with me, I'm not allowed to have it. But I don't know whether I'm wrong, John, but my understanding when I've asked the question, the mechanism of action of that, I'm told it actually does the similar thing. It binds and neutralizes the spike protein.
Yeah, could well. It would make sense, wouldn't it?
But I find it incredible that, for me, my concern is like, why are somebody, my big concern is, this technology is being rolled out for other things, right? And let's find out now what's going on and why bury our heads in the sand, and let's some positives come out of it. There's enough people affected, and I'd just like some good to come out of it and study us and find out what's going on, rather than it's like, I must be an idiot. Like, I don't understand why I'm being ignored, and treated like this.
Well, you and me both, Adam. You and me both.
Yeah.
And the fact that you notice similarities with Brianne means that there's the potential here for putting together a cohort of people with similar clinical features. And that is how you start a research project. This should be getting done.
Yeah.
It's just such an obvious way to do the research, and yet it doesn't seem to be happening. I mean, it's frustrating for me as an external observer, but for you to be suffering on a daily basis, I can't imagine what the frustration must be like. It must just be appalling.
It's John, I'm sure you've had this before, it's like, I took the vaccine, so it's my responsibility, but when I never got informed consent, unfortunately, because...
No, you took it because you thought it was the right thing to do, and you were told the vaccine was safe and effective.
Yeah, I didn't
Same
get
as
told,
when I took it.
I didn't get told it was experimental, that hadn't been authorised, And, I since find out that the vaccine manufacturers told the government that we don't know the long-term effects. So I'm like, fair enough, okay, that's happened. This has happened to me. Now, I did my buy-in, but you guys won't even... It's just like that. It's like, just leave him to it. We don't... And I don't blame the doctors here in the NHS, but someone in the government or someone high up in the NHS needs to turn around and go, do you know what? This is what's happened to these poor people, and let's at least try and do our best. It might not bring everything back for us, but at least I feel like people are being genuine people back and trying the best, rather than leaving me, and leaving so many others.
You're an inconvenient truth, Adam.
100%, 100%. Yeah, yeah,
You're also a human being, and I find the whole thing completely outrageous. Where are you with the compensation, the government compensation scheme?
yeah. I've applied for it, but because I've been under so many different doctors and so many hospitals have been sent up and down the country. I've been to two different hospitals in London, Birmingham, three hospitals in Manchester. I've been everywhere, you name it. They're having to write for the notes everywhere, so it's just ongoing. My case is being investigated. Um, I'd just like to say, though, I'd like to point out that it's £120,000. It's not about money for me at all. However, the reality of the situation is that money I was earning, I was lucky, I was earning above average income. But even on the average UK income, it's 4 years worth of income.
Exactly.
Yeah,
It's not a fortune. And the blood scandal, the inflected blood scandal, I think they're looking at something like 2 million each.
yeah. Well, again, for me, John, I'm not looking for money. If anyone gave me any money tomorrow, it would be paying to get treatment.
Exactly.
Because I'm not getting it off the NHS.
All you want is to get better.
I wanted to prolong my life for my children, and to and to be just like anybody else, just be a good person. And obviously I can't provide for myself, so I could be potentially homeless soon. So what am I supposed to do?
Yep. We need a ownership, we need a response, and we need a way forward. And at the moment, we really haven't got one. On a brighter note, we're meeting this weekend, I think, on Sunday, aren't we, at Glasgow?
We are, and it's something, again, we're hugely grateful to yourself for coming. I mean, really excited about that, and some other great speakers. I can't
This is
wait.
the back to the is it bring on the noise?
Yeah, I think he's a chap
Yeah,
that
yeah.
makes a bit of noise. Yeah, John Watt.
Yeah. We have interviewed John and Alex, of course.
Yeah, and Alex is somebody who's I've heard his story many times, but when you interviewed him again, it's very humbling to listen to his story.
Alex was one of the 68 people or so in the country, I think, that's had the compensation because he had a leg amputated. I mean, you can kind of see that, can't you? If you have a leg amputated, it's something fairly obvious.
Yeah,
Whereas, whereas with you, it's kind of,
yeah, easy to brush aside.
it's kind of harder to see. So yeah,
I've got so much. I owe Alex so much because Alex was
good
the
bloke.
person that was there when I thought I was the only person this had happened to. I wasn't someone for social media, and Alex found me on social media, and I was in the hospital, John, and he called me, and it meant so much to me. So yeah, can I show you what? I've been really touched by this. So Manchester United have actually given us a signed top to auction at the event. So I'd like to just show you. I'll just grab it. So I'm really pleased about this because obviously, we're censored everywhere, and just want to show everyone. I don't know if you can see the signatures on there.
Yeah.
So that
Oh,
that
is
was
it
from the,
signed?
that was from the cup final squad who've actually signed it before the cup final.
Really?
Yeah. So Man United have spoke to me and hugely supportive of us, and I've just been like blown away that everybody else in mainstream media and people. It's been a real battle to get anyone to listen to us, and yeah, Man United have donated that to the event. So
Signed by the whole team?
signed by the cup final squad. Yeah.
Wow. Is this going to be for the raffle or something? That must be the main prize.
I think we're going to auction it because
Auction, that sounds better, yeah.
yeah,
But, if you're in the United States, you won't know, but we're just describing the crown jewels of British sport here.
there are quite a few American Man U fans, John. There's quite worldwide fan base.
Yeah, no, it's a huge deal. I mean, no, I think if it's an online auction, that should, because the whole point of this event, all the speakers, including myself, taking no fee at all. I think all the speakers have turned down expenses. I've certainly refused expenses. It's purely to raise money for people with vaccine injuries. That's it. That's it. That's what it's for.
Yeah, I can confirm nobody's taking any money, John. Yeah,
that's good. Okay, so we'll report back after that, of course, and it'll be good to shake hands when I finally meet you, Adam.
Yeah.
We've talked a few times, but for now, thank you very much, and of course you're welcome back anytime for further updates, and people around the world will be relating to the symptoms that you've described, and
and again,
that's the main reason for doing this, really. You're not alone.
No, and I'll be honest, I didn't read all the comments because there was so many after last time. If people want to contact me, the best way is probably via X or Twitter. My handle is at oneads, ONEADDS. The only reason I'm putting that out there is I just want to say, like, we're all trying to fight this thing together, and it's only if we all have a collective voice that anything can change and any good can come out of this. So I just appeal to everyone to connect and stay strong together. And there's times on this journey where, I'm too sick to speak out and other people need to take the baton forward. And so I just want everyone to keep working together, keep connecting, and let's hope eventually some good can come out of what we're doing. Yeah.
Absolutely. Adam, thank you. Looking forward to seeing you on Sunday.
You too, John. Thank you.